Hello everyone, happy Friday to ya. This is Dr. Barry at Adult and Pediatric ENT. It's hard to believe that this week has already gone by. This is my last day in the office this week, and then my partner, Dr. Shapiro, is going to be here in the office for us next week. I'm coming here to Facebook to talk to you guys about another ENT concern that we commonly see, tinnitus, or ringing in the ears. That's the medical term for it. It's something that we actually see rather frequently. It's a common problem, actually. Over 50 million people in the population have it. I think the current research and statistics here in the United States is kind of around that 12 million number experience ringing. And that ringing doesn't have to necessarily be ringing. For some people, it's more of a buzzing noise. Some people will hear it as kind of musical notes or crickets or other sounds. And some people have it kind of as this high-pitched ringing. There's two types, or kind of the way we think about tinnitus as clinicians is subjective tinnitus, which means that the patient can hear a sound that we can't hear. There's no external or outside stimulus to cause that. And then there's objective tinnitus, which is the patient can hear a sound and we can also hear it. And there's different causes for each of those things. But particularly we see most often the benign form of tinnitus can happen, we think, because of some type of ear damage that's then sending a signal to your brain that something has happened, and that brain sends a signal to the auditory center, and it perceives it as a sound. So things that can result in ringing in the ears are going to be noise exposure, loud noise, loud music can do it, a really loud concert can cause it, other health problems can cause that, changes in blood flow, spasms in the ear, or spasms of the muscles of the ears, jaw misalignment can do it, some scarring and other ear infections can do it, sinus infections can do it, medications can also actually cause ringing in the ears, one of the common ones being aspirin, and sometimes some changes in the thyroid function can also be some causes of ringing. In terms of, for more times than not, the tinnitus ringing in the ear are for benign reasons, but oftentimes we do see an association with hearing loss, not always. But that's definitely something that's kind of the start of the process for us, where we would get a hearing test if you've never had one and see what's going on with the hearing testing itself. Hearing loss can kind of also be a signifier or a kind of a precursor there to the ringing sometimes. And so that's kind of where we would start in terms of workup for the ringing in the ear, just to make sure some of these other things are not going on as well. Some of the treatments for ringing in the ears that we use are kind of simple things to do at home. So one of the things is to distract your brain. Particularly, we have patients come in that say, that ringing, when I get busy doing something in the day, or if I'm at work, or I'm talking with my friends, or out having dinner, I don't notice it. But when I notice it the most is when I'm trying to get a good night's sleep and just can't do that. And that's definitely a very common thing. So one of the things we tell you to do is use a white noise machine or a fan. Now in the days of Spotify and Pandora, it's really nice. They have even, I think, a white noise machine playlist, or there's even some apps now. The iDream app, I think, has it in there. I don't have any financial ties to any of these things, by the way, so they're just random recommendations there. But nice playlist if you particularly like the rainforest noises or the tramping through the woods kind of noises. I think there's playlists for those too. And the goal of that is kind of distraction of the brain along there to kind of help with the ringing. There are some foods and some other exposures in the environment that we notice that worsens ringing. One of those things is going to be caffeine. I love my cup of coffee in the morning, but for people with ringing, that can make it worse. So trying to cut back on your caffeine use is important. Alcohol and tobacco exposure can get you in terms of ringing as well and worsen some of those things. So kind of cutting back on your exposures to those is something we would recommend as well. And the last thing is sodium or salt. And so everybody, usually for the most part, a lot of people are pretty good about not necessarily adding salt to their diet. But it'll surprise you. You start looking at the back of these labels. If you've ever gone on a diet and you had to pay attention to how much sodium you have, it's in everything. It really is. It's in a lot of the food that's prepared for us. A lot of the foods when we go to the restaurants have higher sodium levels than we would ever have. And some of these longer term preservative, long frozen foods can get you there too. So We call that lovingly a no cats diet is the way you remember that. So caffeine, alcohol, tobacco, salt, try and avoid those things when it comes to ringing. In the other two things that we kind of talk about with patients as common causes of ringing in the ears would be a lack of sleep, which you should be shooting for those 8 hours a night. I know that's sometimes hard to get, and in these times, sometimes people's sleep can be interrupted. And the other one that goes hand in hand with that is stress. So in the days that we're in, everybody's pretty stressed. We've got anxiety for other things, and if that's something that you can control by yoga or other kind of meditative things to kind of decrease the stress, or just do something that's fun for you, those are often some of these conservative measures, as we would say. There are some more specific treatments that we'll occasionally use, including hearing aids. There's something called a tinnitus masker, which is kind of a fancy hearing device or hearing aid that has the ability to put some noise into the ear canal and kind of work like a portable noise machine, if you want to think of it, and has some added fancy features with that as well. And then also there are some therapy options in a concept called biofeedback. Again, there are some medical conditions that can cause ringing. There are separate types of ringing in the ears and other things, and particularly if you hear it in one ear more than the other, we would want to definitely check into that. So if that's something that you're experiencing and you're looking for an ENT doctor that's willing to see you for it, we certainly are here. If you have had changes in your hearing or questions about your hearing, that's definitely something we do. Here at Adult and Pediatric ENT, we actually have a hearing division. We are able to do hearing tests right in the office and oftentimes pair that with a visit with one of the docs. We have two wonderful audiologists that are so intelligent when it comes to all the testing, know so much about hearing aids and all the cutting edge technology there, and can get you fit with the right hearing aid if that's something you're interested in, and if that's something that you need, we can kind of be your one-stop place for that. Both Sam and Jody are audiologists, and they're great. And in terms of the docs, we all like to see these things. We are certainly happy to help with your hearing. So if you have any questions when it comes to ringing in the ears or other hearing stuff, please feel free to message us here. Send me a message at the office. You can always call our office or send us even a text through Clara if your hearing or ringing is something you're interested in being seen for. I'm going to miss you guys here. This is my last day in the office, and then I'll be rotating as the backup doc and on call. But certainly we're still here for you guys. So don't forget us here at Adult and Pediatric ENT. If you need us, please don't hesitate to call us. Have a wonderful weekend. Happy Friday, and enjoy a little bit of that sunshine out there. Bye.